Hey, good morning. This is Dr. Winters, and I need to talk to you about an important concept, especially for autoimmune patients, patients who've had strokes, patients who may have chronic degenerative conditions, even a lot of fibromyalgia patients. And that's the concept of neurological energy. We only have so much. Some people in great shape, they're like horses, that we can do anything with them, and other people, when they're in a weakened state, a stroke patient, I may literally only be able to treat 30 seconds the first time. Even some severe autoimmune patients, the first session with me, I've only been able to do 30 seconds. These are the most severe people, of course, but 30 seconds of treatment, and then their nervous system is done. But that 30 seconds will have a huge gain if we don't exceed their neurological energy. And so I see reports all the time, and I have patients all the time who go for physical therapy when they're in a weakened state and then they crash. It's because the therapist didn't understand the concept of neurological energy. This has to be monitored in some way. In our office, we monitor it at the spleen 21 reflex point, and once that shows, we're done. I don't care if it's 30 seconds or it's an hour of treatment. When that point goes weak, we are done. And so that's how I monitor it. That's how we keep track of it in our office. Other docs or therapists may not have that understanding, but they got to monitor it some way. They got to read the patient's reactions. They have to read the patient's nervous system. They have to look at their muscles. They have to look at their performance. As soon as their performance in the therapy starts to decline, they've got to stop. Because when you stay within that window, then the patient can make gains. When you don't stay within that window, the patient will suffer. The patient will backset. I've seen it hundreds of times, and it's so important to learn for chronic autoimmune cases, for stroke cases, and many others. So I just want you to be aware of that concept, be able to use it. If your therapists are not aware of it, then you're going to have to tell them. They have to watch you. As soon as performance starts to drop, they have to stop. That's how you win in therapy and things with autoimmunity and with stroke patients and others. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.